Colorectal cancer. Colorectal cancer, also known as bowel cancer, is a malignant tumor arising from the inner wall of the large intestine, colon or rectum. It begins as small, non-cancerous polyps that form on the inside of the colon or rectum. Colorectal cancer is the third most commonly diagnosed cancer in males and the second in females, with more than 1.4 million new cancer cases every year. In India, it is the seventh leading type of cancer. Etiology of colorectal cancer is still unclear. In general, the cancer can be due to a combination of genetic and environmental factors. The risk factors of colorectal cancer are of two types: avoidable and unavoidable factors. Unavoidable risk factors are prior history of colon polyps and bowel diseases, family history of colorectal cancer, and having a genetic syndrome, such as familial adenomatous polyposis. Avoidable risk factors include obesity, smoking, heavy alcohol use, type 2 diabetes, sedentary lifestyles, and diet that is high in processed foods or red meats. Early signs and symptoms are iron deficiency anemia, rectal bleeding, abdominal pain, change in bowel habits, and intestinal obstruction or perforation. Late-stage signs and symptoms include unintentional weight loss, changes in bowel habits that last longer than a month, vomiting, jaundice, and swelling in hands or feet. Colorectal cancer are of 5 stages. The staging is based on tumor size, location, existing in lymph nodes, and whether the cancer has spread. Diagnosis of colorectal cancer is performed by conducting laboratory studies, imaging studies. Diagnosis of colorectal cancer is performed by colonoscopy, sigmoidoscopy, and biopsy of suspicious lesions. Treatment of colorectal cancer depends on the location of cancer, its stage, and patient's health concerns. The management of colon cancer mainly includes surgery, chemotherapy, radiation therapy, targeted drug therapy, immunotherapy, and palliative care. Surgery is the mainstay in the early stage of colorectal cancer. It involves cutting away the portion of the colon that is diseased and reconnecting the two healthy parts. A temporary or permanent colostomy may be needed. Chemotherapy involves the use of drugs to kill cancer cells. Chemotherapy is an adjuvant after surgery to destroy any remaining cancerous cells. Radiation therapy uses high-energy rays or particles to destroy cancer cells, mostly for rectal cancers. In general, radiation therapy can be used before, during, and after the surgery, or along with chemo to help control cancers if a person is not healthy enough for surgery. Targeted drug treatments focus on specific abnormalities present within cancer cells to destroy them. Drugs are usually combined with chemotherapy. Targeted drugs are typically reserved for people with advanced colon cancer. Immunotherapy is a drug treatment that enhances the immune system to fight cancer. It is recommended for people with advanced stage of colorectal cancer. Immunotherapy drugs to treat colorectal cancer are known as checkpoint inhibitors. Palliative care is a specialized medical care that focuses on providing relief from pain and other symptoms of a colorectal cancer.